It's a real pleasure to be here today. I know a number of people here in the room, and it's nostalgic, but it's inspiring, and it's. I feel very humbled to even have been asked to speak, because there's many other health professionals who could have also spoken. I am offering the health professional perspective, and it's a very personal one. When Neil asked, it was a few months ago, about talking about what motivated me to be doing more now in outreach than I had before. But actually, I realized that I've been doing the outreach over the years, and I thought about the fact that I have been in 6 larger cities, 6 states. So I've had opportunities to have contact with different organizations that have focused on respiratory care, health care. I think that has also shaped my desire to do more with lung health. But in the beginning, it was a very self-focused journey. I was interested in developing my own interest and skill sets in pulmonary care and respiratory health care. And one example, it was at that time called the Chicago Lung Association. The Chicago Thoracic Society gave free lectures, and they were for all the pulmonary fellows that were in the Chicago area. So there's a large group of people who were learning and discussing and on kind of the cutting edge of science and healthcare, which was stimulating. But another piece that I wished I would have put on here was my experience in working in different healthcare settings and having experience of working with persons with chronic lung disease and who were obviously suffering in their day-to-day lives, the quality of life so sorely affected, that helped motivate me in my efforts. Another part of being motivated were the professional contacts that I have made over the years in my professional organizations, and particularly this is Rita Kim, who is one of the first nurse Ph.D. Physiologists working on diaphragms and canines, and she was interested in COPD. She turned out to be a great mentor for me, was dean at the University of Illinois School of Nursing, and was key in recruiting me into their Ph.D. program. Additional areas that helped to motivate me, and I'd like to thank the American Lung Association and Breathe LA for funding some research studies in the clinical area. I'm in the more symptom management arena than I am in a laboratory or bench. And one of the areas that I was quite aware that made a difference for people who used it correctly was the breathing strategy of gentle prolonged exhalation. It's often self-taught. It has been known to reduce the dynamic, as opposed to static, hyperinflation that occurs with people who are moving about, who are standing up, sitting down, and how a simple way of keeping your exhalation prolonged does make a difference in how you experience the dyspnea with activity. And it's achieved through pursed-lip breathing, and then as Buck mentioned, with the frequently combined with diaphragmatic breathing. But I was able to receive funding to validate that this is indeed, there is a background, a scientific basis for why this does make a difference. And it was in a randomized control study that was funded at the VA. And then what Breathe LA helped do was to take this the next step, and was to study how Skype, one of the methods of real-time interactive communication, could take place between the healthcare provider or people, professionals in the lung associations, could utilize this means as a way of reaching people in their homes. And so there was a pilot study that was done that were compared those who received it and not received it, who had COPD, and there were definitely an increase in the decreased dyspnea, shortness of breath, and also an increased sense of social support. Did not measure depression, and I think if I had, I may have found a difference in that area also. But just from the scientific basis to be able to validate what it is that we do to help people, does make sense. How motivated recently? That's my little dogs, Muriel, who's recently died, which is sad. I recently retired from full-time work. I am doing some, actually it's minimal part-time work now at West LA VA, but I have much more time, and I'm ready to give back, and I have a sense of feeling nurtured with the contacts that I've made with Breathe LA, so that's kind of helped move me along in that direction. And the impetus now for my involvement, and I don't know how many others this might relate, is that I received an email blast, I think that came from Claudia in her email blast, seeking volunteers for getting the NHLBI COPD campaign off the ground. I volunteered, but I think it was in July, August, and because at that time it was a good fit for me, the timing was right, and then there was the opportunity. And I do think that each of you are in this room because you have found that you're here today because coming here made it fit with what your interests were, right? The timing was right, the day was pleasant, you decided to make the effort, and you had the opportunity. So that's my little story. Many of you could have said the same story, but thank you for allowing me to tell